Well, hey there, pharmacy owners. Dr. Lisa Faast here, and welcome to 2025. Yay! Good riddance to 2024. And I firmly believe that 2025 is the year to go on the offense, right? We have been playing and forced to play defense for the last 18 to 24 months as pharmacy owners because of all the DIR fee changes, shitty, crappy reimbursement changes, like just all the things in our industry. I think we've made it through. If you're here, you've made it through all of that. And so now it's time to kind of recapture our business, really take control of it, grow it in the way that you want to grow it, and make sure that your business fulfills all your needs. And those needs are varied. That you have financial needs from your business. You need to support your employees, yourself, your families, your communities. You need to fund growth. You need to fund your future. But there's also like professional fulfilling needs. Like part of owning a pharmacy, you're fulfilling some of those professional needs. And there's lots of other things as too. So I want to help you turn your pharmacy into the pharmacy of your dreams and make it be what you want it to be. So this video, I'm going to be talking about a product that might be able to help you do that. I get asked a lot about high margin products or, good products or things like that. And there's some all over the board. There are certainly products where you can make $5,000 dispensing, and we all know the ones that you could lose $500 at dispensing. And there's a whole bunch of in between. This is one of those products that I'm going to be talking about today. I think it's a cool product as a compounder. This was actually one of the first compounds that I made, over 20 years ago in my pharmacy. And there was a pharmaceutical company that just went through the FDA approval process for this ingredient to make it a commercially available FDA-approved product, so that basically every pharmacy and patients all over don't have to only be if they have access to compound or only if they can compound. Now you can partake in it. So cantharidin, many of you know, has been around for forever. As I said, I first compounded this over 20 years ago, and it was one of my first compounds when I opened my first pharmacy. Cantharidin is used topically. It's what's called a blistering agent. So it causes a blister on the skin, which you would think like, what is that? But it treats Molluscum Contagiosum, which is a virus that is often seen in pediatric patients, which, no disease is good, but, disease with children just, gets my heart. And it's an itchy, painful, kind of rash with the bumps. And so to kill the virus, you can put the cantharidin on each of the little bumps. It'll cause a little blister, and then the blister will heal and it goes away, and you got like this nice clear skin underneath. And so previously it was really only available if you were a compounding pharmacy to fill, because you couldn't fill it as a retail pharmacy, and therefore doctors were kind of limited in options. They were having to choose to either like freeze these all the little sores off, and sometimes they're covered in hundreds of them, and that was obviously painful for the children, or to kind of dig them out, if you will, surgically, which is also painful for the children. So it just wasn't ever any consistent option for that. So there's a new FDA product of cantharidin. It's called YCanth, and that's spelled YCANTH. And it's an FDA approved product. So that means no matter what kind of pharmacy you have, you can order this and you can dispense it, and you can help your pediatric patients get over their Molluscum Contagiosum. It will not go away on its own. It will continue to spread, and it'll even spread to other people, other siblings, other family members, which is not good. And it's not only is it painful and itchy, which is discomforting to the child, it's also embarrassing. They're contagious. They can't participate in school or other activities. And so we want to help those pediatric patients get over this as quick as possible. Now, very rarely, as a compounder myself, I am generally not a fan when pharma comes in and makes something FDA approved that I've been compounding for a really super long time, because I feel like it kind of takes away from, what I can do as a compounder. Usually because pharma doesn't really improve it. Sometimes they even make the product worse. In this case, Verica, who is the curator of YCanth, has actually improved the cantharidin product in a way that's actually really exciting from a clinical standpoint. If you see any pictures of YCanth, or if you ever order it or you apply it to any patients, you'll see that it's a purple liquid. And if you know cantharidin, you know cantharidin is not purple. It's a clear liquid. But the cool thing that they did is they added Genesian violet to actually put a color on it, because when you're dotting a child, hundreds of sores all over their body, it can be hard to remember and to know which ones that you did already. So the purple provides a dosing guidance to whoever provider is applying the YCANTH. Usually it's going to be their pediatrician or dermatologist. Pharmacists can be trained to do it as well if that's something that you want to do, especially if you're in a really rural area. But the purple basically is a color coding system that says, hey, you already did this spot, don't do it again. The other thing that they did is the tip applicator is a super precise tip applicator. I think it goes down to 0.1 millimeter of like little tiny diameter, which is way better than I know a lot of doctors, when I used to make my cantharidin compound for them, they would use Q-tips or like toothpick tips to try to get, small little tiny dots, because you only want the cantharidin on the skin that's infected. You don't want it on, healthy skin. You don't want to blister healthy skin. You only want to blister the infected skin. So it's got this nice little tip that's tiny and helps it get it right on the spot of where the infection is. The other thing is, if you're an old timer compounder like me, you are well aware that cantharidin, every time you open a cantharidin bottle, or you made it for the doctor and they open the bottle, the concentration changes. The volatility of the cantharidin, over time, it will change the concentration of the cantharidin that you made for them, which obviously can lead to bad outcomes. It becomes more concentrated, becomes stronger over time, every single time that bottle is open. And so, the amount that they applied to the first patient, the 50th patient using that same bottle is going to get a higher strength just by the nature of the chemical itself. And so what YCANTH did in their little applicators is it's completely sealed. So no air is getting in. It's not changing concentration over time. So, if that product is sitting in the doctor's office for months or something, it comes in 2 applicators. Usually a patient can be treated with 1 applicator, but it's good to keep that second applicator in case they missed any, and they need another dose. So that second applicator can, they can hold on to that for weeks or months, and it's not going to change concentration. And so that way, the dot that they took at the beginning is the same as the dot of the medication that they take, no matter how much time has gone by. So if you're a pharmacy that is interested in growing in strategic ways that are both good for your patients and good for your pharmacy, I highly recommend you check out this new product. Again, it's called YCANTH. And if you go to order it from FFF Enterprises. Now, you might be thinking, that's where I get my vaccines from. FFF Enterprises does a whole lot more than vaccines. They do a bunch of like specialty and niche product distribution. And so there's some really great benefits on why you should purchase from FFF. There is one primary wholesaler that carries it, but you're not going to get any discounts, and you're not going to get their generous payment terms. So if you're going to purchase YCANTH, purchase it from FFF Enterprises. Chances are you already have an account there because you probably buy your vaccines from them. But they're going to give you extended dating, and you also can, if you buy in bulk or you buy more, they have some price discounts as you go up, because we've had several pharmacies that kind of become the hub for this in their neighborhoods or in those rural areas. And so you can actually, if you buy more cases, I think it starts at more than 4, you actually get discounts, pretty significant discounts per the little packet. So it's really good to buy from FFF. So even if you see it on your primary wholesaler, I would purchase it from FFF, and that way you get the cash flow benefits, and you possibly, depending on how much you end up using it, you might get some discounts as well that wouldn't be available through your normal wholesaler. Now, Verica, that has the YCANTH, they do have a coupon program that makes it max $25 out of pocket. So, we're January here, a lot of deductibles have reset. That won't be a problem. Your patients will never pay more than $25 out of pocket for that. So in the comments and description below, we'll put some marketing materials. We'll put some links for you guys so you can learn about this a little bit more. If you have any questions, obviously you can let me know. Happy to answer them. But this is a product that I wanted to make sure sure that you, my video watchers, are aware. Well, I've been sending out emails on it, but I know not everybody's on our email list, and not everybody checks email, but they might check video. So I just want to make sure that you're aware of this product out there. It is FDA approved. It's called YCanth, and it's for cantharidin. It's FDA labeled for Molluscum Contagiosum. You will see dermatologists and pediatricians using it for warts and some other things. Obviously off-label use is certainly within their realm of their ability to prescribe it for, but it's officially for Molluscum Contagiosum. And let's help those pediatric patients get over this and help them get back to healthy skin and back to their normal lives. So if you have any questions, don't forget to pop it below. Always here to help you with anything about running a continuously profitable, awesome pharmacy. And let's go kill 2025. Bye-bye.